So, this is part 3. Don't worry if you missed part 1 and 2. I'm going to be putting a link for those into this blog, this video, so that you can catch up. But ultimately what we're going to talk about now is the anatomy of the spine and how it sits into the pelvic bowl and how the two can have ascending and descending influences upon each other. So your pelvis has 2 ilium and the spine finishes with a sacrum that sits in between those ilium, and where the 2 bones meet, or the 2 areas of the body meet, the pelvis and the spine, is called the sacroiliac joint, where the sacrum meets the ilium, and it's where your pelvis moves when you're walking, so you get this rotation, or you hopefully get this rotation around it. So you can imagine how, if those rotation isn't working, that can influence your spine in an ascending fashion. So what we did last time was looked at how to get this movement, how to improve it, how to get it feeling better. Now we're going to be talking about the descending influence of the spine or the sacrum and the way that sits in the pelvic bowl. So, how is your caveman squat coming on? Have you done the pelvic test? Did you try the exercise? And have you retested your benchmark? Let me know how you're getting on with that already, but remember, we have only just begun. So today is going to be all about the spine. Last time we were talking about the pelvis. We're going to be working our way through the body and understanding which part of our bodies, or which combination of parts of our bodies, ultimately is influencing the way we squat. Because it isn't necessarily going to be just one area, which is what most people assume. They want a single answer, a single point, a quick fix, and it doesn't work like that. The body is a complex series of pulleys and levers and sensors that allow us, or maybe don't allow us, to do the physical tasks we want to achieve. So, as I mentioned in part 1 and 2, the body is an integrated system, and if you're struggling to perform any kind of squat, really it's a fundamental movement that we should be able to achieve. However, it does involve several joints, and if we add in load, weight, bars, kettlebells, then that's going to change what's happening as well within the body. So we need to understand each area of the body, how well it's working, and how it's helping or hindering our ability to squat. Now, if we add a load onto the top of the spine, then we might question whether lumbar flexion is acceptable or not. And you can get away with it for a while. So if your squatting technique, and when you're coming down, you get some lumbar flexion, or even thoracic flexion, any kind of spinal flexion, initially, you're going to get away with it. The body is a master of compensation. It's really good at allowing you to perform the movements you're trying to ask it to do. But over time, if we keep doing that and we're loading the spine, and you've got a compressive force at the anterior side to open at the back, we're then putting ourselves at risk. We've got to protect those facet joints that limit movement, that are going to be loaded compressively with the load on the back. So we need to be mindful of that. So we talked a little bit about the butt wink last time. The butt wink includes lumbar flexion. So without a load, fine. You can squat down, flex as much as you like, that's okay. However, with a load, we might consider limiting the amount of flexion we allow in the spine. So let's just think about function at the moment when it comes to the spine, and you should have a kind of a natural C shape, so a shape in your spine. Some people or some races will have more of a J spine, some will have more kyphosis, which is the curvature at the top, and some will have more or less lordosis, which is at the bottom. Kyphosis, lordosis are natural positions for the spine. We don't really have super straight spines. Everybody's slightly different, but we should have some natural, slightly S shape through the spine. Interestingly, at the lumbar spine, we have the most capacity at each of those joints for flexion over any other movement. And if you consider the fact that the lumbar spine is probably naturally already in some extension, actually going into flexion more would then make sense. So I think there's become a sort of a negative attitude towards flexion of the lumbar spine because of the sedentary lifestyle, the durations that we're sitting in lumbar flexion. But lumbar flexion is a natural part of movement. And if you caveman squat with no load, down onto your haunches, like we did last time on our benchmark, the lumbar spine should flex. The femur will eventually hit onto those ilium, and that's not a bad thing. So don't worry about flexion if you've got no load. So what I'm going to be showing you in part 3, the spine, in our project squat A2G, is how to test your own spine. So you can do this yourselves, just like the pelvic screens I taught you last time. What you can do is you do a test. I'm going to show you some exercises. You can redo the test and see if that helps. Don't worry if it doesn't help straight away. Maybe there won't be any big changes immediately. It's taken us months or maybe years to get into the mess our bodies are in. It's not going to be a quick fix. It takes time. We've got to reprogram the body. We've got to give it the ability to move better, and it's not always a quick fix. So if you want to continue squatting, but you find there is a point at which you start to flex, maybe your pelvis is still slightly limited, maybe your spine is a little stiff, I suggest you squat, if you're loaded, just to the point where you begin to lose that kind of neutral spine position, if you like. Continue to work on the drills that we did last time, the drills I'm going to give you today, and then as you improve your mobility around the pelvis, sacroiliac joint, the lumbar spine, thoracic spine, you should see an improvement in the depth of your squat and your ability to maintain that nice natural curve in your spine. So if you read the blog that goes with this video, the juice mail, which is on www.biomechanicseducation.com, click on blog and you'll find the blog in there. We talk about Stuart McGill's term, the break point. And he terms the break point basically the butt wink, or the point at which when you're squatting, you lose that natural lumbar and thoracic curve. So go and check that out and give you a bit more details in the blog. Now, we should also be mindful of those who overcompensate, trying not to flex in the spine, and they hyperextend. So as they come down, they actually force those facet joints together in that hyperextension. This is another problem that we should be trying to avoid. So make sure you've got a video or somebody taking a video of you side on so you can check where you get your break point, whether it be flexion or hyperextension. Remember, this is under load. If it's done without load, then there is a much lower risk. Now, before I show you some of the tests to understand how well your spine moves, let's just talk very briefly about core training and core stability, because this is a massive conversation in the industry and very controversial. Everyone seems to feel they have a weak core and need to strengthen it. So I'd like to just challenge that for a moment and suggest that maybe we're not weak. If you can walk around, get in your car, drive to work, pick the kids up, go shopping, then your core isn't weak. What we need to consider is, what is the definition of weak when it comes to the core? The question is, if we think our core's weak, is strength work actually what we want to do? So we need to consider all of the things that would make our core appear weak, feel weak, or make us feel a bit of ache or pain or discomfort, which is always diagnosed as weak core. So let's challenge that for a moment. And if we think about muscles in the body that laterally flex us, like QL, quadratus lumborum, which is going to be part of our core stabilizer, hip flexors, psoas particularly, which comes into your lumbar spine at the front. So that's going to control any leg movement when you're lying supine or on your back, lifting the legs to train your core. If this muscle is dysfunctional, then this is all going to challenge your ability to control the core or the spine or the trunk stiffening. Because if they don't work properly, the other muscles around the spine are going to have to help out and do their job. So maybe they're not weak. Maybe they're inhibited. Maybe they're in spasm. Maybe you've got tight nerves. I'm going to be talking about nerves next time in part 4. So we need to understand that intrinsic function first, remedy that, then we need to consider retraining the core strength principles. Core strength is often obtained not through strength training necessarily. We do strength training, but what that's doing is reprogramming the proprioceptive reflex reaction of the muscles around the trunk to stabilize us properly. So once we've got QL, hip flexors, glutes working properly, they have the ability to then work well together synergistically to share the load, stabilize us nicely and strongly so that we maintain our neutral spine and we have less risk of sore backs and problems happening with our movement. So I'm now going to take you through a series of tests to understand how well or how badly your spine moves. Number one, I want you to understand that these are for healthy, average adults, children as well, with no clinical medical conditions or injuries. If you have clinical conditions, injuries, anything like that, or pain, please do not do any of this until you have spoken to your doctor, your physio, your GP, your biomechanics coach. Go and get it checked out first, because what I'm showing you is really for healthy bodies that don't have pain or injury. Okay, so there are several movements that the spine is capable of, and we've got a whole series of vertebrae that should be sharing that load. So none of these tests should feel painful. They may feel stiff, tight, or slightly tender in areas. That's kind of okay. That's what we're looking for, but there shouldn't be any pain. If there's pain, please stop, go and see your biomechanics coach or your therapist, as I've mentioned before. The first test is called spinal flexion. So what I'd like you to do is sit with your feet firmly on the floor, underneath the knees, hips around about 90 degrees, so you shouldn't be kind of too high up, and you shouldn't be where the knees are kind of higher than the hips. Place your fists on your thighs, and then starting at the chin, round the chin, and then we're going to slump the body, and you're aiming to flex and round the spine all the way forwards. We're going to aim the shoulders towards the thumbs. So nice and relaxed, we don't need to force anything. Round the back, all the way down, all the way up, and if you can get your shoulders to your thumbs without forcing it and no discomfort, you pass. Okay, so the next test is for spinal extension. So I've just turned side on, you can see here, same again, same principles applies, feet underneath the knees, hips around about 90, sitting up, not too tall, just a kind of a relaxed upright position. Looking straight ahead, all you need to do is extend the spine, which is kind of a tilt in the pelvis combined with lumbar extension. Relax, and again. Can you do that without discomfort, without tension, and do you see a little bit of a curve? So you might want to set a video up, just like I have, do this, and then you can watch back. Or if you can see side on in a mirror, I've got this mirror behind me, as long as there's no tenderness, it's not uncomfortable, again, you pass. But if it feels tender, if you're not able to extend, then we need to do an exercise for that. Keep watching. Okay, so the next test we're going to do is thoracic rotation. In my experience, this is the one that most people commonly find challenging. The problem is there can be a slight cheat to testing how much your thoracic spine rotates. So I'm going to show you the test first and then explain what we want to try to avoid that makes it look like a pass. Okay, so in this position, all the same setting up rules as previously. Place your fingertips on top of your shoulders, elbows in a straight line, not forwards, not backwards, straight out to the side. If anybody has a difficulty with this position, usually guys with big biceps, then just literally bring the hands just in front, thumbs to the front anterior deltoid. From here, what we want to do is rotate as far as we can, keeping the hips straight, so don't let your knees shift. And we want to see if we can get to 45 degrees of rotation, both sides. So imagine a cross over your head between front and back. From there, and we want to measure, do you rotate 45 degrees one way, back to center, and then test the other way. So I'm more limited to my right side, and you might find that. So that means I need to do the thoracic rotation exercise. However, what happens and what should happen in function is when you rotate, your scapula or your arms will also rotate. What we're trying to identify is how much rotation in your body is coming from your shoulders and how much is coming from your thoracic spine. Your thoracic spine alone should be able to achieve at least 45 degrees. So if you're not sure if your arms are helping you look like 45, then what you can do is take a broomstick or a pole, place it over the shoulders. What that does is it kind of fixes the scapula in the arms a little bit so that when you rotate, you get a more accurate view of how far you're going. Again, you might film it for accuracy and then see how far you go each side. If you feel a little bit stiffer one side compared to the other, then you probably need to do the exercise. Okay, so we're now going to test side bend. Now, this might include your quadratus lumborum muscle, the one I spoke about earlier, which goes from your ilium up to your last rib and inserts into your lumbar spine. It's also a mobility test, and without having a biomechanics coach who's trained in these tests to observe you from the back, it would be a challenge for us to know whether it's spinal mobility or whether it's the QL hindering your side bend. So I'm going to teach you the QL exercise for this if you get a positive result, or if you get like a bit of tension one side to the other, you can't move so well. So again, same setup, hands down by your sides. This time, keeping both hips on your seat and making sure you imagine you're between two planes of glass, one in the front, one at the back. You take a side bend over to your right. Now what we're looking for is obviously no discomfort, and the range should be your elbow, so the bony part of your elbow, the medial epicondyle, should be able to reach without any force the seat height, or at least your greater trochanter. So if you're a big person, if you're muscly, or you have extra size in your glutes, we might allow to greater trochanter, which is the middle of the hip. If you're a size like me, then really and truly you should be getting that medial epicondyle to your seat height without any rotation or discomfort. We do exactly the same the other way, and I am definitely feeling tension over this side, and I can't get so far. So again, ideally, I'm going to need to do that exercise. Keep watching, exercises are coming next. So if you found, like me, that you felt slightly stiffer in your rotation test from one side to the other, or maybe for you it was both sides and you didn't achieve 45 degrees, there are a couple of things we can do. I'm going to show you the seated one first, and then I'm going to show you some techniques lying on the floor. So same thing with the pole. Guess what? The test is basically the exercise. So what you can do is use your pole to keep the shoulders or the arms nice and still, and instead of just doing it once or twice, we use it as a mobility drill. You might also use your pole, so my right hand can actually push the pole forwards, which is pulling my left arm backwards, and then we do the same going the other way. So mobility is really reps and maybe sets. So I need these. Let me know how you're getting on with yours. Okay, so some floor moves now. Some of these you're going to be familiar with, but I'm going to teach you how to make them very specific for the areas in your body that you found, or your spine, that you found to be most stiff or limited. So do you remember the flexion test where we had the knees on the thighs and we rolled forwards? If you felt stiff in that one, if you felt like you, or if you didn't get your shoulders towards your thumbs without forcing it, this is a great exercise. So nice and simple, lay down on your back, relax the body, lift one knee, don't bring it too close, lace the fingers over the top, and then without trying to use your abdominals too much, this isn't called training, we want to pull the shoulders away from the floor. Let that go, relax, change, and then lift the other side. And again, we repeat this like a mobility drill. Reps and sets. Maybe begin with sort of 8 reps, 2 or 3 sets, maybe once a day, every other day. See how you get on. Keep filming your caveman or photographing your caveman squat. See how that helps you to improve. Again, let me know how you're getting on. So was spinal extension the test that you found tension, discomfort, or you couldn't actually arch your lumbar spine. You remember that side view? This is a really cool one. It's so small, it's so simple, and yet it can have a profound effect. It's called pelvic tilts, but what happens when we tilt the pelvis is it actually takes the lumbar spine into extension. So if you watch, it's very small. From neutral, we go through extension and a little bit of flexion, and we repeat. Now this is a tiny movement. If you feel tender in extension, don't go too far, don't go into the tenderness, and what we want to do is keep it as a continuous movement. So we're starting to gently mobilize specifically that stiffer area in the lumbar spine. Eight reps, 2 or 3 sets, 1 a day, see how you get on. So I've shown you a seated rotation exercise, but I've got 2 more for you lying on the floor, and I really like these. These are 2 of my favorites. We've got knee rolls and shoulder rolls. Knee rolls is more for your lumbar spine area, and then shoulder rolls more for the thoracic spine. And we really want to share it all out between the body. So you can try either. If you had the difficulty in the rotation of getting to 45, then any of these 3, the seated, knees, or shoulder rolls, can be good for you. So pick one that feels good. So again, take a lie down. For knee rolls, feet and knees together, arms out to the side, and we gently rock knees side to side. But hey, listen, wait. What I want you to do is not try to get your knees to the floor. We're purifying lumbar mobility, lumbar rotation. So check out my knees. What's not happening is I'm not allowing the knees to shift. If that happens, the movement is no longer coming from the lumbar spine, it's coming from my hips. So I'd rather keep a smaller movement, quality movement, and pure to the lumbar spine. Both shoulders need to stay glued to the floor, and what we can do is enjoy the feeling of getting that spine rotating. If it feels good, if you can go a little bit further with both shoulders on the floor and the knees still together, take it a little bit further. How many reps? Start with 8, see how you get on. So if you like lumbar rolls, let me take you through shoulder rolls. Same setup, but this time, feet hip width apart or thereabouts. This time I'm going to move the upper body. So we lace the fingers, take the hands so they're above the center of the chest. We're going to try and keep the nose and the thumbs level. This time, we rotate the upper body, and what we're trying to avoid is, again, allowing the elbow to bend, allowing the hips to move, or the wrists to bend. So we purify thoracic rotation. Now listen, can you see how it's okay for the head to come away from the floor? Particularly people with broader shoulders, yeah, they may get to a sticking point, so you can actually lift the head to allow you to keep going. I like this one. Okay, so what I'm going to show you here is an exercise called wall glides. This is great for that side bend test if you felt more tension from one side to the other. So you need a wall, and you're going to stand away from it around about a kind of an elbow's breadth. So if you kind of measured your fist in your waist, elbow away, feet close together, and then what you're going to do is lean against the wall. Imagine you have a newspaper under your armpit, and then from here you're going to glide the hips underneath the ribs. Now, while it looks and feels a little bit like a mobility exercise, it's actually a proprioceptive muscle energy technique on your quadratus lumborum. The idea is we're asking that QL muscle just to give us a bit more movement around that area. It shouldn't hurt, so remember the rules on whether things are painful. However, commonly it can feel a little bit tender, maybe one side more than the other. So I'm just going to turn my back so you can see it from the back to do my other side. So what I'm doing is keeping the movements very small, very slow, and very controlled. If you start with 8 reps twice a day, and then you can slowly build up to maybe 15 reps 3 times a day if this one works for you. The beauty is what we've got is a side bend test, an exercise, wall glides. We then redo the test. If it feels better, we're going down the right route. So try out the tests, try out the exercises. Remember, it's not going to happen overnight. This is information for you to start implementing into your warm-up, maybe doing it a few times a week, a day, whatever you can fit in. I suggest daily with the mobility, 4 times a day with what we did last week, the anti-spasm, so you can do that stuff sitting at your desk if you remember. Start adding this into your lifestyle. This is about combating what we're doing to our bodies by living these sedentary lifestyles. Some people may be on their feet all day. This can be as problematic to the body as well. The more we can encourage natural movement intrinsically with our whole body, systematically start each body part moving better, the more longevity we have to a healthy movement profile. So what I'd like to do is just run through some more questions that are coming in. By the way, I love these questions and people sending me your squat videos, your squat photos, side on. Thank you so much. I'm going to put some more up when I get a little collection again. So thank you to those who've sent them in. I will be using them. And what we're going to do is the before and after shots. That is the whole point to this. If you're watching and you're wondering when I'm going to get to your bit, remember, there is a whole series of videos still coming. This is only number 3, and there's loads more to talk about. There's not just the pelvis and the spine involved in squatting. We're going to talk about knees, shoulders, feet, shoes, nerves, everything else. The biggest question, that you need to ask yourself is, why do you want to squat? What kind of squat do you want to achieve? What's the goal? Which squat will help you get there? Or are you just looking for improved movement? You've got to get the answer to these questions first. That will dictate what you need to do. All of the tests and exercises I'm giving you will help with all squats and all ideas and goals. But to make it specific, send in your questions. I'll try and hit each one, and we'll see if we can help everybody out there. There's just so many variables and so many different body types. It's got to be case by case. So I've got 3 questions this time. So Richard Bruce, he said, my entire running club can't caveman squat. Where do I start? Richard, if you go back to pelvis and stay at part 2, start there. It's a great place to start, super simple. Just get them all lying down on the grass, do the 4-sign test on themselves. They can then do the 4-sign exercise, retest themselves, see the difference, and then go for a run. Definitely a good place to start. Now, we've also got Carolina, who asked about squatting with a lower back injury. Carolina, I'm so sorry. I cannot give you an answer. I can't diagnose online with that simple information. You really need to go and see somebody, get yourself tested, so they understand what your lower back injury is, how that's impeding on you, and they can best advise you on moving forwards. Finally, Jilly. So Jilly has asked, how can you help those elderly improve their mobility? Jilly, this program is perfect for the elderly. So a lot of elderly people out there are really fit, by the way, and they move exceptionally well these days, if you've watched some of the clips that I've posted through Facebook. But I'm aware that as we get older, joints wear down, we are going to be exposed to more risk of getting injuries and things. So we need to be more cautious about the types of exercise. However, if you look back, Jilly, over the series of videos that I'm doing for you, what you'll see is the techniques I'm giving you are super safe. Last time, static, 20% hip contraction. You can't get any safer than that. Today, super slow, simple, low grade, small movement mobility drills. So try them out, Jilly, if you're concerned. Obviously, again, normal protocol, get them to see somebody, but if they're in your hands, I'm sure that you're going to be able to look after them. Let me know if these drills are helping you out. Let me know how you get on with your clients, if you're using them with them as well. Please, 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 keep posting me your questions, keep posting me your caveman start point, and I'll see you next time. Oh, before I go, I nearly forgot. I've got to let you know what we're going to do next time. I'm so excited. We're going to be talking about the nervous system. The nervous system is really impactful. It's the software of the body. So don't miss out. Sign up for the juice mail. Next week, we're going to be talking how the nerves can limit your ability to squat. See you then.